Are you a registered nurse that's planning on taking your NCLEX RN exam? Today's video is a must-watch for you. In today's video, we will be covering 7 medications that shows up on 90% of NCLEX RN exams. These are the ones that you absolutely need to know, and I will give you key information on how you can remember these medications. So grab a notebook, take some notes, and without wasting any time, let's dive right in. Hello registered nurses, my name is Karen. I've been a registered nurse in the US for about 6 years now, and on this channel, I'm helping registered nurses from all over the world get through their NCLEX RN journey with flying colors. So as I mentioned earlier, this video is a must watch for anybody who is preparing for the NCLEX RN exam. In today's video, we are going to be going over 7 medications that is a must known for anyone taking their NCLEX RN exam. And I have asked multiple people, and there is 90% of chance that these medications are going to show up on your NCLEX RN exam. So the first one on my list is Lisinopril. Lisinopril is an ACE inhibitor that is used to treat blood pressure, or we can say it is used to treat high blood pressure, also known as hypertension. The most important points to remember for Lisinopril is, number 1, it is used to treat high blood pressure. Number 2 is Lisinopril helps relax blood vessels that eventually lowers your blood pressure. The most common side effects for Lisinopril are dry cough and elevated potassium levels. Now, the most important things to remember as a nurse for Lisinopril is make sure you monitor the patient's blood pressure, and this medication should never be given if the patient already has a low blood pressure. So as a nurse, it should be on top of your head to hold this medication if the patient's blood pressure is on the lower side. Second medication on our list is metformin. Metformin is a medication that is given to patients that are diagnosed with type 2 diabetes. Let's talk about the most important points to remember for this medication. Metformin helps lower blood glucose by reducing glucose production in the liver and by increasing insulin sensitivity. Another important point is it should always be taken with food to reduce the chances of GI problems like nausea and vomiting. As a nurse, while administering metformin, you should always be careful of a serious complication called lactic acidosis. The second most important nursing consideration is if a patient has any kind of kidney problems, metformin needs to be stopped. You cannot give metformin to a patient that has kidney issues. Number 3 on our list is warfarin. Warfarin is a blood thinner that is often prescribed to patients that are high risk for blood clots. It is prescribed to patients with atrial fibrillation or who has a history of DVT, also known as deep venous thrombosis. Important points to remember while administering this medication are warfarin works by inhibiting vitamin K dependent clotting factor. The most important thing as a nurse while administering warfarin is to keep monitoring the patient's INR level. The therapeutic range for most patients taking warfarin is 2.0 to 3.0. Another thing that a nurse needs to know before administering this medication is that it interacts with foods that are high in vitamin K, like leafy vegetables. So as a nurse, you need to be cautious about not feeding your patients with green leafy vegetables when they are taking this medication. Number 4 on our list is called Lasix or furosemide. Lasix is a loop diuretic. This one is often used for patients that are fluid overloaded, have congestive heart failure, or any kidney problems. Now let's talk about the important points to remember while administering Lasix. Lasix helps the kidneys get rid of extra fluid and sodium. Now, as a nurse, you need to keep in mind that the side effects for Lasix could be hypokalemia, low potassium, dehydration, and also low blood pressure. One of the nursing considerations that you always have to keep in mind while administering somebody this medication is to keep monitoring their blood pressure. This medication should never ever be given to any patients that's blood pressure is on the lower side. Another important consideration for nurses is to keep monitoring this patient's electrolytes, especially potassium, because a lot of the times when our kidneys is trying to flush all these fluids out, it can also flush the potassium or other electrolytes from your body. Number 5 on our list is called digoxin. I'm sure a lot of you have probably heard about this medication. It is a medication used to treat heart failure and atrial fibrillation. Now, the important points to remember for digoxin is it increases the force that the heart contracts at, thus decreasing the heart rate. Now, the most important nursing consideration for this medication is digoxin toxicity. While you're administering this medication to a patient, you should always watch if the patient is nauseous, is vomiting, or has any visual disturbance. That are some common signs of digoxin toxicity. Another important point for this is you should never ever administer this to a patient whose heart rate is below 60 beats per minute. Number 6 on our list is alprazolam. It is also known as Xanax. It is used to treat anxiety and panic disorders. Now, the important points to remember for you as a nurse is that this medication is an anti-anxiety medication and it works by depressing the central nervous system that further helps to calm your anxiety. Now, as a nurse, you should always be careful that the patient's respiratory status is not declining, patient is not overly sedated, and the long-term use of this medication can cause dependency. Another most important factor to keep in mind while administering this medication is that the patient does not have any consumption of alcohol or opioids from before. This medication interacts with other CNS depressants, so be very mindful of this. Finally, number 7 and the last one on our list is Naloxone, also called Narcan. There is a very high chance that this medication will come up on your NCLEX RN exam. This medication is a life-saving medication that reverses the effects of opioids. Naloxone works by binding the opioid receptors in the brain, reversing respiratory depression caused by opioids. Now, the most lethal side effects of opioids is it can cause severe respiratory depression. So this medication helps with reversing the effects of opioid overdose. It can be given intranasally or IV as well. Now, the most important thing to remember for you as a nurse is if you have given somebody this medication, it might temporarily reverse the effects, but we have to keep monitoring this patient as the patient can start having respiratory depression again. And another thing that you need to monitor is that the patient can go in withdrawals. So you have to provide the appropriate nursing interventions for that as well. Alright, there you have it. Our top 7 medications that could show up on your NCLEX RN exam. And these medications are crucial for your NCLEX RN success. So make sure to memorize their uses, their side effects, and also their nursing considerations. If you found this video helpful, make sure you like it and subscribe to the channel for more videos like this. And if there's any topic that you want me to make a video on, I would love to do that for you. So leave it in the comment sections below. Good luck on your NCLEX prep. And thank you for watching this video, and I'll see you in the next one.